apologize. My Great Dane is barking in the background. I don't know what she's barking about. The door.
She has something to say about public health.
It's good stuff.
Yeah. Okay, we're streaming live. We're going to go ahead and call the Board of Health meeting for the City of Kent to order on December the 8th, 2020, and it is 5:33 p.m. Madam Secretary, would you call the roll, please?
Yes, I just wanted to check to make sure I was off mute. Good evening. So Chris Wolverton,
Here.
Emily Mattern,
Here.
Pam Ferguson,
Here.
Jack Amorine,
Here.
Louise Frederick. We'll give her a few more minutes. Michelle Frederick. And we'll give her a few more minutes too. I'm not sure if Michelle's coming or not. We also have with us several other individuals. We have Amia Singh, who's one of our contact tracers who we'll speak with in a short while. Rose Ferraro from Portage County Public Health, and Bob Walker also from Portage County Public Health. And then Angela DeJulius, our medical director. And then I believe we also have Jenna, is it Gottbrick?
Gobrecht, yes.
Okay, and would you like to introduce yourself?
Yes, my name's Jenna Gobrecht. I am a reporter at TV2 News at Kent State.
Is there any particular reason? Are you here for a class or just out of interest, or?
I'm here for our 6 p.m. showing tomorrow of the TV2 News. So I'll be covering stories on other story on, daily cases in Kent and things like that.
Okay, very good. Nice to have you with us.
Thank you very much for having
Yeah,
me.
welcome, Jenna. Okay, I know Mike said that Louise is going to be a little bit late, but we don't know about Michelle.
Should we go ahead and excuse them, and then if they come, it's okay, or?
Yeah, let's do that. So is there a motion to excuse Michelle and, oh gosh, I just went blank.
Louise.
I'm getting old. Louise?
So moved.
Is there a
Second.
second? Okay. Jack and Pam, thank you very much. Is there discussion on the motion? Hearing none, all in favor of the motion? Aye.
Aye.
Opposed, nay? Hearing none, the motion carries. Thank you. You have the minutes of the previous meeting before you, and we were emailed out earlier this week. Is there a motion to approve?
So moved.
Thank you. Is there a second?
Second.
Thank you. Is there discussion on the motion to approve the minutes? Any amendments, changes? Hearing none, all in favor of the motion to accept last month's minutes? Aye.
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 Opposed, nay? Hearing none, the motion carries. Thank you very much. Jenna, did you have anything else you wanted to say to the group? Because we have a time now for open comments if you're interested.
No, probably not. I'm just sitting in here. This is my first meeting with you guys, so I'm just learning the ropes.
Okay, well, welcome.
Thank you very much.
Amia, would you like to make any comments?
I'll just go ahead and introduce myself here. So, hi everybody, my name is Amia Singh. I am a recent graduate from the spring from Case Western Reserve University. I am a contact tracer here at the Kent City Health Department, and currently I'm also doing a lot of case investigation, calling positive cases in our jurisdiction and talking to them and doing interviews, trying to find out, where they are picking up the virus, and any potential contacts. So, yeah.
Super, you're one of the heroes. Thank you.
Thank you.
Yeah, appreciate that.
Amia has a lovely rapport with the people that she speaks with. She does a great job completing as much data as is given to her. So she's a really welcome case investigator for our department. We're really glad to have her and the other case investigators with us.
Wonderful.
Such an important job.
Yeah. Thank you again, Amia. Before you in your packet, you have the statistical report for November. Joan, is there anything that you want to bring to our attention?
No, I think everything is pretty much straightforward and right there. There's nothing really unexpected, and anything that's down is probably just down due to COVID activity and having to redirect our efforts.
Yeah. I noticed that it was time to make our deposit to the state.
Yes.
All right. Would you like to give your health department report first, or would you like Rose to go first?
In the interest of their time, I know they've had some very long days. And I see Louise has joined us. Hello, Louise. Good to have her. So we'll add your name to the roll. Let's have Rose and then maybe Bob with the emergency response plan, if you don't mind.
Not at all. Rose?
Okay, thanks. Hi, everybody.
Hi.
Okay, so you have a copy of the November report. As you can see, we are extremely high right now. We're about averaging 95 cases a day. I'm sure that's going to probably triple by tomorrow once we get all of the antigens in there. Our November 25th was one of our highest days at 125 cases. These are just positive cases. So I'm saying that we are pretty much slammed. So we are working with our staff and our contact tracers and ODH contact tracers. We are right in the work of just doing the prioritizing the cases as far as 25 years old and less, and anybody greater than 65. At that time, we're doing those first, and then we will go back and pick up the others. We've sent letters out to every single person, letting them know they are to be quarantining themselves and letting their contacts know, and also they need to be quarantined. So all of our positives need to be isolated for 10 days. We have explained it in the letter, and also just to let them know their contacts. They can always reach out to us. We've had several reach out to us. As also on there, with the CARES funding, we actually went through Vista Healthcare to do some testing. It was open to the public. Anybody could go. So these are our numbers. I thought they'd be interested to put them in there so everybody could see, because it was not just our community. It was open to everybody. So the last one we did today was Randolph, and we did 261 tests there. So just to give you guys some information, as with everybody else, we are seeing multiple outbreaks. We have several facilities that have outbreaks right now. We're seeing increase in our nursing homes and the jails and everything like that. We have, with Bob's help, designed a committee for vaccination. So we have Joan on that committee, and we have representation from Kent on that committee. These are just the vaccination people trying to figure out what we're going to do as far as how we're going to roll it out. So being that a lot of us were with H1N1, we sort of have an idea of what we're going to do. So we've got UH involved. So we know with Susie, she did a lot of education with all of the EMS where they were taught the vaccine, given the vaccine, and then give it to each other. So Bob's working very hard at getting our pods ready to go, our open pods and our closed pods. So we will be meeting every Monday, and that's going to be at 9 o'clock, and that'll be continuing until the vaccine arrives, because we meet with ODH every Friday with the vaccine and giving us the guidelines and stuff like that. So last Saturday, we met with them, and I'm sure Joan will talk to you all about that. There was a big conference call last Saturday, and it was very good, rolling out some of the information on the vaccine. So it's going to be good when it gets here. I'm just afraid that there's just going to be a lot of work, which there is. At this time, we are not closing our clinics, but I'm sure it's going to be time down the road that we are going to have to postpone them for a while, because we don't have enough of staff to even think of having clinics. So I have Joe going to be reaching out to the health commissioners in the state of Ohio to see who is still offering the clinics. We know there's a lot of already clinics closed. We just want to be able, if we're trying to close our clinics, where can they go to get the vaccines, especially if they need them right away? It's going to be tough because the pharmacies can give vaccines, but only to 18 and older, or there might be some other criteria, their insurance and all of those issues. So there's a lot of issues to go when you give the vaccine. So we know that's coming down the line. So just to prepare you guys too, because we'll be closing, just postponing it for a while. But I do want to say, Chris, thank you for offering your refrigerator, your high power refrigerator or freezer. But I think we're okay right now. From what they sort of speculated, we will not get those doses. It will go to the hospital. So we'll see how it goes. I'm not sure. So still keep us, I'll still may need that. So, so we're still, like I said, we're trying to work through everything. I took all of my staff off all of the other duties right now, except for the immunizations, to strictly do COVID. Where our contact tracers are inundated, we don't have enough to keep us going. So we are actually started taking cases again and working through all of that. So saying that, do you guys have any questions for me at all?
I would just add a comment to something you said, Rose, because when the childhood immunization clinics are suspended, as you expect they will be, kids can go to Access Point.
Yeah. So that's, yeah.
Places.
And we do refer a ton to Access Point, a ton. So, yeah. So, but however, are you going to be giving the vaccine, the COVID vaccine?
I don't know that yet.
So, yeah. So that's our issue of knowing what's going to transpire. So right now I'm hoping to do the whole month of December. Our clinic, we have a lot scheduled. So right now what we're doing for January is just taking a list. So they're calling us and they want to schedule an appointment. We're taking their name, their phone number, and what vaccine they need so that we can reach out. Now, Angela, do you guys have private purchase vaccine as well as VFC vaccine?
I think so. Yes,
Okay.
we do. Yes, we do. I had to think for a minute because I'm not as intimately involved.
Children and
adults, some.
Okay. So what we'll do is just go ahead and then refer them there.
Yeah.
But we'll wait toward the end. So that's what we're doing. And then that way we can call them and say, hey, Access Point or whoever is giving vaccine, please reach out to them to get your vaccine. So that's very helpful. But I sort of want to wait to see how everything transpires right now. We're still like in a holding pattern, but it's something we all need to think about going forward.
It is an important issue because kids are behind on shots now.
I know,
Significantly
absolutely.
because of COVID.
Oh, I know. We're jammed full, our clinics. And that's what I was telling Joe. I said, but I'm also worried. So because of the fact all of our girls are gowning everything, they are in full garb giving vaccines. I have stanchions out, and we'll have to also do the same thing when we go over to do Kent Clinic because of the fact with it being so community spread. I'm just afraid if one of my nurses get out, they're going to take all of us out. And I'm really afraid of that right now. So I have all of these people coming in, which is great. And they need their vaccine. Absolutely. Because we're still doing school vaccines. But however, I have to protect my staff too. We're such at a high rate right now. I need to do everything I can do to protect the staff. I don't want anybody to get sick.
Absolutely.
So, so saying that we are going to be doing that. So what I think I'll do is I'll send, what's her, Stephanie, an email saying, you know, what if we close because we'll be referring. So, but I just want to make sure about the other vaccine in case you guys get it. So going forward, yeah. So that's what we're doing. So Joan, we're going to be touching back out with you just to make sure that because our staff will be in full garb when we go to your clinic as well. Okay, so any other questions?
Rose, do you have vaccine enrollment software, or are you using an EMR? How are you going to track all the people who get vaccinated?
It would actually be in the state registry, the ImpactSys registry, because that's ODH's system. So I'm sure they're going out. That was one of my questions I actually emailed on the conference call. because of the fact with them having pharmacies and other companies and hospitals, they have to allot for their vaccine, just like we did with the H1N1. And I think they're going to be a little bit stringent on that, because with H1N1, it was sort of not so much. But I don't think it's fair for all health departments to have to enter all those thousands of doses, because we actually had to do it with the H1N1, and it really got out of hand. So that was my question to the state on Saturday, but it was not addressed. So I'm sure they're trying to figure that out, because that's going to be an issue when we actually go to get the second dose, because it has to be the same manufacturing as the first dose that they got. So we're going to have to know that information. So it needs to be into ODH within the 3 and 4 weeks or 28 days or whatever before we can give the second dose. So that's going to be a big undertaking for people who have the vaccine and rolling it out.
Right.
So it's going to be very interesting. So that's to come. So hopefully it will, but it will be in under impact. So what we'll do is put in HDIS and then upload.
Okay.
The other thing that was brought to my attention is we can charge for the administration, and I just don't see that in health departments. That is way too much work. It's okay for CVS. They may have a lot more people to do that. However, there is no way that we can do that at our facility, because you have to have a contract with every insurance company in order to bill from them. So it's going to be very time consuming. So that was one of the questions that was addressed on the conference call on Saturday, which I believe the governor has enough of funding to fund us for our administration fee to help supplant the cost of all of our staff, because it's going to take all of our staff, especially when we open it up to the public.
Right.
So any other questions?
Question for you.
Sure.
And I hope since this is my first meeting with you guys, I hope this isn't
Sure.
too broad of a question for you to answer at this point. But as far as Kent State students, testing was covered under CVS for a short period of time, and the Kiva did some testing as well. Do you guys have any plans for administration of the vaccine for students in particular, or is it going to be more of an insurance-based thing rather than being a student of Kent State?
No, it's going to be by the tier-based thing by the government. We won't have control over that. It will be based, I believe, phase 1A is the hospitals and nursing homes. So it's going to be all phase-based. We will not have control over it. It will be dictated to us, and we will follow the guidelines as it dictated. So we'll have to go from there.
That makes a lot of sense. Thank you.
You're welcome.
Anything else for Rose?
Rose, I had a question for you. I'm looking at the testing numbers here from your nursing report. NeoMed sites, they had quite a few tests. Was that targeted to students at NeoMed and staff? Is that why the number of tests is so much higher?
It was open to anybody. No, we did not target anybody. And that was the first one. So, the first one always goes high, because people did, we had the dates out, but we are limited on the number of testing that we are doing. We only purchased X amount. So for this company, but yeah, it was open to everybody. I know they had their own testing. They actually got kits from the state to test X amount of students, and they did that. I'm sure there were some students in there, and I'm sure there were some faculty in there, but we did not close it to anybody.
Okay, thank you.
You're welcome.
Anything else for Rose?
Just a side note of what I've heard with the vaccine coming in about 2 weeks. It takes about an hour to do 4 people.
Yeah, there is a 15-minute wait at the end. However, December the 10th is when Pfizer is going for FDA emergency approval, and the December 14th is the other vaccine company.
Well, no, what I mean is when you're doing your scheduling of how many nurses you need and your crowd of appointments,
Yes.
they say not to exceed 4 appointments per hour because it takes that long to mix the vaccine and garb up.
The frozen vaccine.
Right.
Yeah, I'm not sure if we're going to get the frozen vaccine. That was our concern also.
But even the other one, because we're not getting the frozen, we're getting the second one that came out, not the first frozen one.
Are you getting Moderna?
Yes, Moderna. We're getting that one, and we're limited to 4 patients per hour because we're doing all the nursing homes starting in about, 12 days? Starting on the 20th.
So is are you work for a pharmacy, correct?
CVS, yeah.
Yeah. Okay, so are you getting the Pfizer one? Because I thought you guys were getting Pfizer.
No, we're getting, from what I've heard, we're getting the
Moderna one. Okay.
And you have to get a second vaccine in this 2 weeks.
In 2 weeks?
In 2 weeks. That's what I've been told.
Okay, we haven't got that information. I know something came out today and I haven't read it all, but the thing, yeah, I don't know because it's not been approved by FDA. So yeah, so you know more than I do then, but
yeah, so I guess it is very time consuming and we've been told a limit of 4 per hour.
Oh, okay. So when you guys go into nursing homes, how's that going to be?
We're going to be totally garbed up and we're just kind of an extension of the state. You know, we're just going in and doing as many people. I guess we have 12 hours scheduled at certain nursing homes and we have 8 pharmacists going to each site, I guess. And they hope to do.
All right. So when you're talking the 4 hour, that's when it's at the pharmacy?
No, that's at the nursing home for 4 patients per pharmacist per hour. So that's why 8 pharmacists are going to one nursing home in a 10 to 12 hour shift.
Wow.
Yeah, that's what we've been told.
Wow. That's a lot.
I know. That's why I'm like, what is in with this? Yeah.
It'll be interesting when the guidelines come out to really see what the guidelines are. Right. But then you said, when was the second dose coming?
They said 2 weeks. We're supposed after 2 weeks, we follow up with the second dose.
See, because they said on the conference call, what was it, Joan? One was
the Pfizer was 3 weeks and the Moderna was 2.
That was the other one. I thought it was flipped around.
I thought it was flipped around too.
Okay.
So yeah, I don't, you know what, we don't know because we really haven't gotten the information on the vaccine part yet. So like I said, you know more than I do, but that is a lot. And that's a lot of time wasted. So
yeah, I just wanted to warn you, that's what they've told us, that it's very time consuming and they're limiting us to 4 per hour.
Wow, thanks. So
just so you can schedule in your mind like what you're looking at.
Yeah, because I knew the issue with the 15 wait period. So because if we're doing drive-through, we're trying to figure out more of, because we don't want people to leave. So we're actually like trying to do, like if we do a drive-through, like at least 2 to 3 to 4 bays so that we have the vaccines going all the time. Because at first we're going to probably be doing the EMS and EMTs, and we know that's a little bit slower. It's a smaller group. So, I mean, that is good there. And then we'll just have to build up as we go. But when it gets to open where anybody can get it, that's when it's going to be going crazy.
Yep.
Rose, I have a last question real quick. Do you know, are there any like limitations or restrictions on patients who are possibly symptomatic of COVID or who have had a known exposure to getting the vaccination?
Right now, we don't know because of the fact we haven't got any guideline on the vaccine because it's not been FDA approved. So once that information comes out, it'll go to CDC, which I'm sure CDC already has it, but it will not come out through ODH or anything until everything is done and approved as far as what we're supposed to do, what we're not supposed to do, who could get it, who cannot get it. So I don't know.
Okay, thank you.
You're welcome.
Anything else for Rose? All right, thank you. Bob, you want to give us the FEP report?
Hi, folks.
Hey,
I am the FEP coordinator for Portage County, which stands for Public Health Emergency Preparedness Coordinator. And my role is to help prepare us for disasters such as the one we're in. So here we are.
Going to make it go away, right?
Hopefully we'll be here, yes. So the purpose of the emergency response plan is to make sure that we are consistent, not only in our own health districts or jurisdictions, but also through our county. So we want to have these connectivity and consistency within our county, within our region. We belong to a 13 county region known as NECO 5, Northeast Ohio Central. And then we also want to be consistent with the state and then, of course, national. So the purpose of us talking about the emergency response plan is, I understand that you guys have signed off on this in the past, but we want to make sure that all of the Board of Health understands that we do act under emergency response plan that is tied in with our county, with our state and region. And so that's the purpose. We also have a lot of stakeholders in this project. Board of Health is definitely one of the many. And we also have the hospital, the EMA, the EPA, the American Red Cross. So we have a lot of stakeholders that are tied into this. So hopefully you've had a chance to review, or at least preview the emergency response plan. The biggest change that I have made here in the last couple months with Joan and our Board of Health Commissioners is that we added Kent City, because if this health emergency occurred only in Kent City, then Kent City Health would be taking that lead. In this case, it is nationwide disaster, and so Portage County is taking the lead for the most part. But we have unified command, and we have two health commissioners that talk very much alike. So grateful for that. So the first third talks about who's in charge of different emergencies in their jurisdiction and how we would actually get along. And just to let you know, we have been practicing this since January, Joan? I think we started talking, and by March, we actually activated the Unified Emergency DOC, or Department Operations Center, for both health departments, both Kent and Portage, tied in with EMA, or Emergency Management Agency of Portage County. And we also tied in with the hospital, University Hospitals of Portage. Interestingly enough, we also tied in with Hattie Lartham, who we also considered as a high-risk vulnerable group. So we have a lot of stakeholders and partners in this. So the first third is just talking about how we take care of emergencies here in Portage County and how we're tied into our stakeholders. And it just kind of lays out the basic ground rules. And then the second and third of the emergency response plan is actually tied into the state, how we interact through the state and the national, and it's through the incident command structure. So that's kind of the framework that the emergency response plan was written on. So the two major changes was making sure that we had Kent City tied in and who's in that lead, and then making sure that our language for the incident command was actually updated and consistent throughout the document. And with that, I'll take any questions. Our goal is that, especially coming from the state of Ohio Department of Health, they want to know that our Board of Health understand that we do have an emergency response plan. And so I just need a proclamation from the board when we're done here that you approve of it. And remember, this is a living document. So next year, I'm probably going to come back to you and say, okay, what are the changes? And hopefully we learn from whatever we do here in the next several months with this COVID disaster. Anything I can answer?
We did have several suggestions for edits. I don't know if you wanted, I think it may be too time consuming to go through each one right now, but we could electronically send those suggestions to, some are just, grammatical or typo type things. Others are kind of more philosophical in nature, I guess. Yeah.
Okay, I'll be glad to take those back and put them in the document, and then Were there any questions though that I can answer tonight for everyone?
Hi, Bob. It's nice to see you.
I know, Angela.
I just wondered if, for the benefit of everyone that's here, could you give the Cliff Notes to how FEP works in the way that the grant money comes from the state and the accountability for, what the expectations are? Because it's not just Portage County that does this. Every county does this. And
Yes.
just maybe a bit more background since we have some new faces.
New faces, okay.
Yeah.
So FEP, it stands for Public Health Emergency Preparedness, and every county has one. And that FEP coordinator in each county is responsible for all of the health departments in that jurisdiction of the county to make sure that they have a unified emergency response plan. And that's just one of the core FEP core deliverables that we need to deliver. And yes, there is money attached to that. And so you accomplish a core or FEP core, and then you get monies. And so that's how I get paid, is to accomplish the grant deliverables. So did I explain? So again, FEP is, the whole ideal is to make sure that we're consistent across disaster planning and preparedness. And I know some of you talked about Kent State University, and yes, the universities, all three universities are tied in of how we would interact with them. So thank you. Did I answer the question, Angela, or was that too short?
I think that helps. Yeah. Yeah. Thank you.
Yes.
Bob, what role are you going to play during the vaccine rollout, if any? Are you going to coordinate the MRC to assist Rose and the nurses, or how's that going to manifest itself?
Yes, I'm getting a part of my role is actually coordinator for the Medical Reserve Corps. And that usually is tied in with most FEP coordinators across the state. We are getting ready to put out actually some sort of survey. We have a lot of people that are retired, nursing, paramedics, and our concern is that they are in the risk group, but many of them want to come in and help us vaccinate. So we need to sort out, we do have a medical team that will be vaccinators and people that will validate that you can get this vaccine. And then there'll be another group that's kind of welcoming you in, making sure you're in the correct priority group. And then at the end, making sure that, that 15-minute time frame that you're not having side effects before we send you on your merry way. So we're getting ready to send out a survey to the Medical Reserve Corps, not only activating them, but also finding out what their interests are. And then as a FEP coordinator, we also have to certify that each of those people that say they can can vaccinate, that they're actually valid and certified in the state of Ohio to give vaccines.
Right.
So it's a process.
So will you be activating any of the stakeholders like the Red Cross to be part of this?
I'm not sure that Red Cross is ready to help support that, but that's a good question, Chris. I will actually reach out and ask Cindy if that is something that they do. I know they
for H1N1 they set up a canteen and kind of help take care of the people at that 15-minute post vaccination stage.
Yes. Interesting. I will ask and raise that question. I think they've cut back a little bit, Chris, and they're really focused more towards fire victims, especially during this event.
Okay.
That's what they've been sharing out, is that their focus really is on taking care of those who have lost their home.
Gotcha. All right. Well, thank you, Bob. We appreciate all the work you're doing. And even though you get paid by them, we're really glad you're working with us.
That is true. Thank you.
Bob, did you need a board approval of this document tonight? So yes. Maybe could we do some kind of caveat that with your consideration of our suggested edits, it would be approved? I don't know. I'll let Chris.
Yeah, usually that process, the motion would be motion for approval with the noted edits.
Yeah. And you're needing it tonight then?
Yeah, I'm hoping.
Okay.
Our deadline is the end of this month.
Oh, okay. Then we'll get it for you.
And Chris, I'm sorry. I just want to remind everyone, this is a living document. And again, this time next year or sooner, we'll be talking again about any other edits that need to be changed.
Sure.
Especially as we learn anything from this event.
Oh, and I sure hope we do. All right. I hope the board has had a chance to go through the document, and well, if you would submit your suggested changes to Joan, and then she'll consolidate them and get them submitted to Bob. But in the interim, is there a motion to approve the document with the pending edits?
I move to approve the
I'll
document.
second it.
Thank you, Emily and Jack. Is there discussion on the motion to approve? Hearing none, all in favor, aye.
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 Opposed, nay. Hearing no nays, the motion carries. There you go, Bob. We'll go ahead and certify that the Board of Health approves the document pending the revisions.
All right, thank you very much.
Thank you, Bob. Appreciate all your work. You're welcome to stay if you want to, but if you want to take off, that's fine too.
Oh, if you don't mind, I've got to go work on the 911 sharing of information. So I'm behind today.
All right, take
Goodbye,
care.
Bob. Thank you.
Aye.
Be safe.
Bye. Thank you, guys.
Bye,
Rose,
Rose.
before you go, did you have anything you wanted to say about the communicable disease other than COVID?
Oh, gee, you really want to know? We're just trying to keep up on that. But one thing I do want to say, we've made a form because of the fact, with the STDs, it's all over the place. So we want to try and get more information, especially like demographics, and anything. We're not looking for partners or anything like that as of right now, but we're doing really good gathering all that information, like race, how they've been treated, and moving forward. So it's been really receptive. So we just may start increasing things right now, but we don't have time to do too much of anything right now. So
I thought you would be at least asking them how they got it if they were physically distanced by 6 feet.
we don't even go there. I had one guy that was actually moving and he was wondering why he was tired. And I'm like, he's moved all week and you're wondering if you're tired. I would be exhausted, but anyway, but we're trying to keep up. At least one good thing, we don't have a lot going on. It's just this, which is, I'm really glad.
Yeah.
Now, so it's really tough.
Yeah, I'm sure.
But we're gonna get through it, and we're gonna learn like we always do, and we won't be here for the next one.
100 years, right?
I'm gonna knock on wood on that one.
Hey, I might be.
Yes, Angela, you will be. But no, hopefully not. Hopefully we're all retired and living the dream. So.
Thank you so much, Rose. We appreciate all that you do for us.
You're welcome. Thank you, guys. If there's anything you need, please reach out, okay?
We will definitely do that.
Okay, bye-bye. You too. Stay safe and wear your mask, everybody.
Yep.
Got it.
Thank you, Rose. Okay, we have a number of discussion items that we want to bring to your attention. We've already talked about Bob's collection of the information for the emergency response plan. But as I mentioned, you may have looked through it and thought that there were some changes or recommendations to language that you might have. If there's anything that you think is substantial you want to bring up now, we'll go ahead and entertain that. Otherwise, we'll just coordinate through Joan to make those changes for us. Joan, did you want to do you have a comment on it?
I would just say that there were just a couple of things in terms of such as evaluation of underserved areas, and the response plan is tested in real life situations, so that we would start to make some mention of taking into account the things that we're learning currently into what might make a future emergency response role a little bit better. And then also noting that most catastrophic events impact marginalized populations much more severely than they do others. And there was really no mention of that. And then maybe to incorporate, since Access Point is local here, that they're a great community member in terms of reaching out to those underserved populations. So we would want to make sure that we include them. And then outside of that, it was just, I think, more in terms of that the agencies will work together. But I think Bob was pretty clear in terms of pointing out that depending on where the emergency originates and how large it gets, if it's Kent-based, that the Kent City Health Department would lead. So I think he clearly delineated that.
Yeah, there were a couple of places in the document where that had been missed, so I inserted that. But yeah, you're right. I think he did a good job including us this time.
Well, I noticed in somewhere in the pages, there was a big chart and it listed all of the places and if they were a primary or a secondary place for like shelter or whatnot. They had Kent State University listed, but they weren't doing any of, like, it was blank all the way across.
I think because we're supposed to get that part from Kent State.
Okay.
So we'll contact Julie Volchek, who's the director of the health center and is the coordinator over there for the pandemic committee, and see if they have the data that goes in those boxes.
And I think that now that we've been living through a pandemic, we understand so much more intimately how we need to work together, that I think that there's going to be, I mean, we have those solid relationships now that we're going to see, oh, it's advantageous. Yes, we'll try to make space for housing, or we'll work with you on this project or that project. So that has been one phenomenal, I guess, silver lining that's come from this pandemic, is the relationships that have been built and really solidified within the community.
Yeah. But Michelle, I know those data exist because I wrote their plan.
Okay.
So it's just,
Yeah, I just noticed they were listed. They were listed in someone below them, and there was no data there.
because we have to officially get it from them. I can't just fill in the boxes.
Oh, yeah.
All right. Thank you.
One other question. I didn't feel like there was anything in that whole emergency plan of how to inform the public, I guess. Like if something were to happen, there wasn't like everyone go to the library and that is our emergency shelter area designated for this area. And in Hiram, this is where we go if something happens. I didn't feel like there was any way to tell people. There was no plan to get that out.
So there's an official PIO, or public information officer, that's part of the emergency response team, and it's up to them to do that. The reason why it's not put in the document is because it might change. If, for example, in an emergency where the city's on fire or a tornado has come through, you might actually lose that spot that you had put in the document we were supposed to meet at. So it's left a little fluid intentionally, but it's all coordinated through that PIO.
Okay.
There's a lot of alphabet soup, and there's also a lot of cross-referencing to other documents. So for example, the issue of housing or sheltering people, that's in another, they call the appendices annexes. So there's a support annex, and that's where that information would be. And I suppose it would have been helpful to have all those annexes as well to really understand what they're saying that we're going to do.
Right, I was like, oh, an emergency is going to happen, but I have no idea if anyone will be told or where we would go.
Yeah.
There's a very broad overarching framework from the federal government, and this is really only one tiny slice of it.
Yeah.
But our tiny slice is probably 3, the binders we used to carry around, the thick ones. All right. Anything else on the emergency response plan? Okay. Membership fee for AOHC, Joan?
Yeah, so I just wanted to update the board that it was time for that yearly fee to be renewed. And again, that fee is based on the population of the area that's served. So this year the fee is $681, and that is in my range to be allowed to be approved. But I just wanted to inform the board that I would be making that purchase order, that invoice, and sending that in. Having that membership in the Association for Ohio Health Commissioners, I think, is very important. The networking, they do have educational classes. In the past, they've been in person. I'm hoping that they'll be at least online in the future, so I can take part and learn some of those fundamentals that were kind of skipped over early in the part of pandemic when I first came on.
Yeah, or hopefully you'll have time to do that.
Right. Yeah.
Kent City Health Department expansion space.
Yeah, so we were noticing, especially with the need to de-densify our space here, we're kind of we have a great space here at the Kent Central Gateway in the Parta building, but we are very tightly fit. And in terms of bringing, having classes or bringing even the vaccine clinic, as Rose had spoken to, there's a concern that we're just right on top of each other. We also have 3 contact tracers that are in our other rooms. So one thing that had come up was that there's a vacancy coming free on the ground level, actually, of this building, which would be ideal in terms of maybe relocating vital statistics and perhaps thinking of a clinic space in that area. And it could be more truly set up and dedicated as a clinic space. So we're in discussions. I think that property is actually owned by the Rod Burbick Foundation, but I think that they're willing to give the lease over to Parta, and then Parta would then be able to roll that into our current lease. So they're just looking at numbers and what makes sense and what's affordable. I know that they also, I think, have to formally offer it to the public. So everything is above board and very clear and transparent, that there's no backdoor dealing going on, so all that is going on behind the scenes. Fortunately, I don't have to be intimately involved with that, but Dave Roller, the city manager, is keeping me updated, and so is Claudia Amarine from Parta, is letting us know how things are going. So we're very excited at that potential that we could really start doing, some more programs and offerings, and really have a dedicated space, and so really broaden out. And I think that would be a great goal for our health department to achieve.
Right.
Joan, is that a storefront opening?
It actually is a storefront opening, and it's where Cutler is, and they have right now they share the space with an art studio that has like a gallery there, but we would be able to have the entire space, it would almost double the space that we have right now. It's very nice and much easier access, I think, for the public.
That would be a nice presence there.
Oh, it would be great. Yeah.
All right, thank you, Joan. Update on the FSO renewals?
Yeah, so Justin just wanted to make sure that the board stayed up to date in terms of food service operation renewals of their licenses. Several have gone out of business, and some have indicated that they will not be renewing in March, or that they plan to relocate outside of the Kent City jurisdiction, or they're combining their services in some way in which that they wouldn't need as many licenses as they currently have. So through that process, we will be losing 28 FSO licenses and 11 vending machine licenses as well. So it's a little bit tough, but we knew some of that actually even before pandemic, that Kent State was looking at some of their food service operations and how they could consolidate and streamline. So some of that was in the works pre-pandemic, but some of it has definitely come about with the tough economic situation that the pandemic has provided. One body art establishment has also indicated they will not be renewing their license, but that's mainly, I think, due to the fact that they were a hair salon that did microblading. They've decided to move to a new location and they're renovating, and they thought if their doors aren't open, it's ridiculous to have that body art license when they're not able to use it. So they'll probably look at renewing that once they're open. And then evidently there are 3 pools that have decided not to renew for next year. So we'll lose those funds as well. I have not heard of anything else new coming in that will replace some of those, but we'll keep you up to date. But we did want to just pass that information along.
Thank you, Joan. I want to take us back to the commissioner's report now that we've heard the discussion items, because I think some of those tie in.
Yes, they do. So in terms of a COVID-19 update, the first thing I wanted to discuss was the public health alert advisory. So we were told, I think it was right before Thanksgiving, that we were going into the star level of red level 3, and that we would be given 2 weeks to turn those numbers around. And then if we did not, we would advance or be elevated into the highest level, which is 4, or purple. Well, they decided that our numbers were rising so dramatically, not only here in Portage County, but all around us, that they went ahead and elevated our level a week early. So on December the 3rd, we were elevated to that level. It's more of a warning system. It's not really particularly directive in that it doesn't tell you, okay, when you're at this level, you have to close these activities or establishments and stop these activities. It's just, again, more of a warning. And really what's been explained, I think, pretty well by the governor is that what's really important is to look at what's going on in your own area so that you have a better sense of your risk as you're moving through. But certainly trying not to interact with others, to try to limit those as much as possible. So again, that whole idea of dedensifying, we're doing that internally in the city. We're asking people not to gather. We're asking people to reconsider any holiday plans, keep it to only those that are under your own roof, not to invite others in, and not to attend any gatherings that might be outside of your home. Again, the social distancing, masking, hand hygiene, and all those things, although they seem very basic and elemental, we know are very important in terms of what we have in our armamentarium right now to fight this. So I was notified by Wally Burton. He's from the Ohio Department of Health, and he did speak with me, and I was able to ask some questions of him. So that was an interesting conversation, very kind of a little bit unnerving because we were really not expecting to go purple that quick. But at any rate, in terms of our case counts, which are always rising, currently we have 1,207 total since the start of the event. We have, I don't think that number's right, 124 active cases, and then 80 that we're monitoring through the Ohio contact tracing system. And that's been very difficult actually to keep up with in terms of people that you call don't always give you the full information. They don't always offer everything that you feel like maybe there's more information there that they're maybe holding back on. Some people don't return calls, so that's been challenging as well. But then just the sheer number of cases on a daily basis has been very hard. As of yesterday, I know we were behind approximately 70 cases that needed to be called. We did contract with the state of Ohio. So in addition to the 4 contact tracers that we have in-house, we are contracting with the Ohio Department of Health. They had initially given us 6 to 8 people, and they had to pull those off into other counties that were receiving 200 cases a day. So we're definitely not as bad off as some, so that's, I guess, a good thing, but it is still very hard to keep up with. In terms of the new quarantine guidance that the CDC came out with just last week, the Ohio Department of Health officially adopted those. They still feel that for quarantine, 14 days is the safest and the best approach. I know some health departments are saying, 14 days is best, we're not going to deviate from that. I feel like we have to follow whatever the Ohio Department of Health says we should. So they do have alternatives for a 10-day quarantine as long as you're asymptomatic. So for those people who cannot get a test, and it's very challenging right now, unless there's an available pop-up testing, to get that test when you're asymptomatic. So, but you would quarantine at home for 10 days, and then you would be free to go about your normal routines, but you would have to continue to monitor yourself twice a day and wear a mask. And then, of course, if your symptoms changed, you would need to go for testing. The other one is 7 days of quarantine, as long as you're tested on day 5 after the date of your last exposure. And so what many people do, as soon as they find out that they've had a close contact, they immediately run out and try to get tested. And so we've had a few disappointed individuals that say, what do you mean it has to be day 5 or later after last exposure? So we need to do some messaging to the general public and that so that they understand that this is not just a 7-day and you're out. You have to get that negative test result, and then you would again continue to wear your mask and continue the twice-a-day monitoring. But that's I think it makes it easier for those businesses that are struggling because they have so many people that are having those close contacts. But at the same time, it puts a lot of stress on the health department in terms of who's validating those negative results, who's checking to make sure that you did get that on the right, you did get tested on the right date. So we're leaving a lot up to the public, but right now, as Rose said, they're asking their cases to tell their close contacts. So it's we're doing what we need to get by in terms of having this peak in the emergency. In terms of pop-up testing, we had decided we were supposed to have our last and final pop-up testing on December the 5th, but because of the experience that we had on the 18th with slow turnaround for test results, some gaps in the data, we wanted to make sure that process was improved before we would contract with that same service to do that again. I think the service that Portage County is using, they've reached out to us, so that might be another viable alternative as well. In terms of testing then too, the antigen tests are now going to be considered straight off instead of having to be verified, the Ohio Department of Health, so that they don't have the manpower to verify all that testing. So those tests, I believe, were added either yesterday or today. So there was supposed to be a one-day visible increase in cases that should not be occurring on a regular routine. We are, in terms of vaccine, as Rose mentioned, we are meeting with the state every Friday. We're meeting with Portage County every Monday. And then internally, we're also meeting with the planning committee to start looking at our vaccine plans and what we might be considering to do. In terms of the state, I know that they said that they would closely follow whatever the ACIP guidelines stated, but that where they needed to deviate, they would. But the intention was to closely follow that. I was actually very pleased that they decided to move long-term care and those workers up into Group 1A. Also, other congregate care settings were moved up to that level as well. So I'm sure we'll be learning more. I wish that I had the time to watch that FDA approval for the EUA, but I'm hoping to be able to catch some snippets of it. In terms of then the food service organizations, I think I gave that update about those people that won't be renewing. Our inspections continue in the food service organizations. That's one thing we have decided not to alter because we feel that the safety of food is so important. So we want to make sure that that's ongoing. Housing inspections, we have been paused on that until our risk level lessens. We feel it's a two-way street. In case we might be asymptomatic, we don't want to bring it into another household, but we also don't want to have our staff pick it up in a household and then bring it back to the department. So we will definitely address all housing complaints. Those will not go unattended. So we will follow up on those. We'll try to do a telephone call first. If that doesn't work, we can do virtual inspections. And if it must be in person, then we will definitely do that. We will keep the people as safe as possible. And outside of that, I believe that is the end of my report, unless there's any questions.
Hey, Joan, I just wanted to not forget about Amia, who we wanted to have talk about some of her contact tracing adventures, and then have the board ask any questions or have any comments.
I'm sorry. I thought that when she spoke earlier, I thought that was absolutely Amia. I'm so sorry. Go ahead.
Maybe that was. I'm not sure.
You're fine. I didn't really ask for any questions, but yeah, I mean, I reiterate everything that Joan had said about these quarantine periods and people getting some unpleasant news about maybe getting a test too early, not wanting to follow through with the full quarantine periods, or just having some confusion around that. So yeah, I reflect everything that she just said. But if anybody has any questions for me about my experience as a case investigator, contact tracer, I am open for those.
Amia.
Yes.
Question.
Yes.
What's the most surprising thing you've encountered in your contact tracing work?
Oh, that's a good question. I think one of the more subtle things that's somewhat surprising that I've noticed, especially when I'm approaching kind of who I'm going to call as we've been overwhelmed, we've had to prioritize who we're calling and certain demographics. We obviously want to get either end of the age spectrum, so anybody young and anybody older. But one thing I've noticed is can kind of encompass both categories is calling folks that are kind of between the ages of 40 and 55, because oftentimes these folks will have been in contact with children and their parents. And so, and those folks can also have some more severe outcomes. So that's been a little bit surprising. And I guess, something that what you wouldn't necessarily think of, but that's something I've been kind of using to approach when I'm picking who I'm going to be calling for the day.
Oh, that's so interesting. Thank you. Yeah.
Of course.
The multi-generational effect.
Yes.
Yeah.
Yes.
I have a question for you, actually.
Yes.
For the news or anything, my personal interest. Have people been honest with you, honestly, through the contact tracing? Because whenever I think about the demographics of a college student, personally, I would tell the truth, but people who go out and do things they're not supposed to, have you found that certain age groups are telling the truth more than other age groups?
There's a little bit of that going on. It kind of depends. I will say there's not, when I pick up make a phone call, I kind of don't know what I'm going to, experience. It's a little bit of a 50-50. I do come across folks that are very skeptical of, giving me their information. I will say that a lot of Kent State students are willing to tell me who their roommates are, any potential household contacts, any family members, stuff like that. As far as attending gatherings and going to social events, I'm not sure. I don't have any way to verify that. I have had some that will be very upfront with me about it and fess up everything that they've done, which is great. I've had people that will tell me the detail of every store that they've been to, every restaurant they've visited, which I wish we could do more with that information.
Yeah.
But it's kind of across the board.
Gotcha.
So, yeah.
Great. Thank you so much, Amia, for all you're doing.
Oh, yes, of course.
All right, board, we have a couple of items that we need to consider and vote upon. So the first of which is our monthly expenditures and encumbrances. That's in your packet, and I'll need a motion to approve, please.
Move to approve.
Thanks, Pam. Is there a second?
I second.
Thank you. So there's a motion and a second. Is there discussion on the expenditures and encumbrances for November? Joan, is there anything you want to highlight before we vote? No?
Chris, she's on mute.
He's muted.
I regret to inform you you're on mute.
Thank you. Thank you. So I was just the last item for the auto glass systems. We had to have new glass installed since we moved. If this hadn't been pandemic, we would not have had that glass installed. So we are going to ask CARES Act money to cover that. So hopefully that amount will be reimbursed to us through CARES Act.
Great, thank you, Joan.
And then I would just say that Kyle declined his, they have a shoe allowance, and just because of the budget and concerns, he said, my shoes are fine. I don't want to do that. And I said, well, if your union demands it, let's not do anything that's going to upset the union. But he said his shoes were in good repair, so he would prefer not to stress the budget in that way. So
Tell him thanks for the board.
right.
Yeah.
All right, you have a motion on the table. Is there any other discussion? Okay, hearing none. All in favor of the motion to approve expenditures and encumbrances for November? Aye.
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 Opposed, nay. Motion carries. Thank you. We have the final reading for the resolution for the swimming pool fees. Madam Secretary, if you would read the number for us, the title and number.
Sure. This is resolution number 2021-002, and it's the Kent City Health District acceptance of a resolution to increase local licensing fees for public swimming pools and spas in the Kent City Health District.
Okay, we've previously read and voted the last 2 months. This is the third reading and third vote. Is there any comment from the guests who are visiting with us? Hearing none. This will be a roll call voice vote, but I'll need a motion first. So is there a motion to approve resolution 2021-003, is it? No, 2.
2.
2.
002.
So moved.
Thank you, Jack. Second?
I'll second.
Thank you, Louise. All right, there's a motion and a second. Is there further discussion on the resolution? Hearing none, your vote is to approve the resolution for its final reading. Madam Secretary, would you please call the roll for the vote?
Certainly. Chris Wolverton,
Aye.
Emily Mattern.
Aye.
Oh, you're muted. Pam Ferguson,
Aye.
Jack Amrine,
Aye.
Michelle Frederick,
Aye.
Louise Frederick.
Aye.
All right, so we have a unanimous vote. The motion carries. We have resolution 2021-003, which is the body art fees, also in its final reading. Madam Secretary, would you read the number and the title, please?
This is resolution number 2021-003, the Kent City Health District acceptance of a resolution to increase local licensing fees for body art establishments in the Kent City Health District.
Thank you. Is there any comment from the guests who are visiting with us today? Hearing none, is there a motion for approval of the resolution?
So moved.
Thank you, Pam. Is there a second?
Second.
Thank you, Emily. There's a motion and a second. This also will be a roll call vote. Is there any other discussion before we vote? Hearing none, Madam Secretary, would you call the roll call, please?
Chris Wolverton,
Aye.
Emily Mattern,
Aye.
Pam Ferguson,
Aye.
Jack Amrine,
Aye.
Michelle Frederick,
Aye.
Louise Frederick.
Aye.
All right. It's a unanimous vote. The motion carries. So thank you all for that. And then the last item, which is a carryover from our executive session from last month, is an official adoption of the 2021-2026 strategic planning document that we reviewed last month. Is there a motion to accept the document as written?
I move to accept the document as written.
Thank you, Emily. Is there a second?
I second.
Thank you, Michelle. Is there further discussion on the motion to approve the strategic planning document for the next 5 years? So the only thing I forgot we should have put on it is get rid of COVID first.
Right. Yeah.
All right, no further discussion. We'll go ahead and call the vote for that. I don't think we need a voice vote. Do we? A roll call vote?
I don't believe so.
Yeah, I don't
You do
believe so. Okay. So all in favor of the strategic planning document before you? Aye.
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 Opposed, nay? Motion carries. So we'll officially adopt this beginning the first of the next calendar year. And Joan and I and any of the rest of the members of the board who would like, we can sit down and specifically iron out very specific goals that will reflect the deliverables that we put into the document. I know Angela has agreed and taken upon herself to help us write metrics for it so that we'll demonstrate to others that we're achieving our goals. And so hopefully by the next board meeting, she'll share those with us. Is there
Absolutely.
any other business to come before the board?
Chris, if I could add for the strategic planning document for accreditation, I'm going to go through the document. I didn't have a chance to go through it, and just make sure it checks off all those accreditation requirement boxes. And I'll do that ahead of the January meeting. But one of those would be having actual metrics, so I can already check one off in my head.
Great. Thanks, Mike. We're glad that you're always watching over our shoulders to do that.
So Mike, maybe as I'm working on it, I'll run it by you so you can add those.
Yep, that works. Sure.
Super.
Hey, Chris.
Yes, Pam.
I'd just like to thank Dr. DeJulius. I've been on this board for many, many, many years, and it's just really nice to have you at these meetings and so involved. So thank you.
You're here.
Thank you. That's very kind of you to say. Yeah, happy to be here.
We certainly appreciate you. All right, is there a need for an executive session? Hearing none, is there a motion to adjourn?
So moved.
Jack, is there a second?
Second.
We stand adjourned. Thank you very much, everybody.